Now let's follow the money out the door. California's general fund spending is dominated by three program areas: education, health, and human services, and correct that together consume roughly 85 to 90% of the budget. And much of it isn't discretionary, it's mandated. Education is the single largest category, and its minimum level is constitutionally guaranteed by Proposition 98, passed in 1988. Through a complex formula, Proposition 98 typically guarantees K through 14 education, meaning K-12 schools plus community colleges somewhere between 38 and 42% of general fund revenue. The legislature can suspend the guarantee in a fiscal emergency, but only by a 2/3 vote, and suspended amounts must be restored later. A major reform came in 2013 with the local control funding formula, which swept away a tangle of categorical programs and replaced them with a base per pupil grant plus supplemental funds for districts serving English learners, low-income students, and foster youth, shifting power from Sacramento to local districts. Note that higher education, the UC and CSU systems, is not constitutionally guaranteed, which is why it gets cut hardest in downturns. The 2008 recession brought cuts of more than 30% over 3 years. The second giant is health and human services, dominated by Medi-Cal, California's Medicaid program, at roughly 27 to 30% of the budget. Medi-Cal has a special feature: federal matching funds. The federal government reimburses California for roughly half or more of most Medi-Cal spending, so every state dollar draws down a matching federal dollar. Medi-Cal covers about 14 million people, more than a third of the state's population, making it one of the most administratively intensive programs in all of state government. The third area is corrections, around 8 to 9%. What's striking is that this share stays stubbornly high even though the prison population fell sharply after its 2006 peak. The reason is cost. It now runs over $100,000 a year to incarcerate one prisoner, the highest in the nation, driven by staffing, court-mandated healthcare improvements from the PLETA litigation, and an aging prison population. The big lesson here: when so much spending is locked in by constitutional formula and federal structure, legislators actually control only a fraction of the budget in any given year.